Welcome to our first class of Mastering Meta-Analysis. These are the steps you'll be following through your conduction of a successful meta-analysis. First of all, you frame your research question. You run a systematic literature search. Then you do the article screening and data extraction, followed by qualitative and quantitative synthesis. And then finally, manuscript writing and writing to a journal. How do you frame your research question? So the topic of this video is basically topic selection, in which you will find out how do you select a topic and how then you frame your research question. So the topic that you select should be interesting, novel, and clinically relevant. How do you select a topic? So you first of all select an area of interest, for example, cardiology, nephrology, or endocrinology. Then you select a disease from that area of interest. You list down at least 10 to 15 diseases, and then you narrow down to one disease. Then you read about the available treatments on that disease. You select a treatment, and then you formulate a research question. So, how do you select your area of interest? In your area of interest, a mentor should be available who can guide you through the process and give you information about new drugs, new treatments, new protocols being followed for that disease. Uh, it may be a field that you might want to pursue in the future, and it should be a field with a lot of new clinical trials. So it should be an ongoing disease or a disease that should have a significant global burden so that you can have multiple new treatments to compare them to previous ones. So, get an idea of the established standard of care for your disease. Are there any new clinical trials assessing promising treatments? How are they better than the standard of care? And if there is no new therapy on the horizon for your disease that could potentially beat out the standard of care that was being used previously, you've probably chosen the wrong disease. Tip that you can follow to find if there is a new clinical trial on your selected disease. You search for your disease on PubMed using the clinical trial filter or randomized clinical trial filter, for example, methotrexate for osteosarcoma. Then you select a treatment. The treatment you choose should have at least one and preferably multiple recently published clinical trials on it. You should probably preferably have shown good efficacy and safety treatment to warrant further research on it. Now that you've selected an area of interest and you've selected a disease from that area of interest, you narrowed it down to one treatment that you will be comparing to the previous one or with placebo. And there are new clinical trials on it, and there is no meta-analysis done on it previously. You now come to the final step of your topic selection, which is formulating a research question following the PICO framework, in which P stands for population, patient, or problem. Who are the patients? What is the problem? So, for example, the disease of choice that we are taking here is myocardial infarction. So now we come on to the I, which is intervention or exposure. What is the treatment that you chose? What are the patients or the population exposed to? So treatment of choice here is PCI. And what are you comparing it with? Comparison is mostly done in most of the studies. It is with placebo, and here we took thrombolytic therapy, and it is placebo in most cases. And outcome, what happens, what is the outcome, the efficacy and safety of drugs, the endpoint which is compared between the two drugs. In this case, it would be mortality, reinfarction, or stroke. Often, study design can also be included in PICO framework, which makes it PICOs. And it would be, for example, systematic review and meta-analysis. In this case, since we're conducting a meta-analysis, it will be systematic review and meta-analysis of RCTs or clinical trials. So, following that example, we come down to our research question being primary percutaneous coronary intervention versus alteplase-based thrombolytic therapy in acute myocardial infarction, a systematic review and meta-analysis of clinical outcomes. Often only P and I are included. That would make it PCI for treatment of MI, a systematic review and meta-analysis. A layout that you can follow in order to generate your title would be intervention for population with conditions, for example, transprimordial resection for patients with pituitary adenoma. And that's all how you select your topic and then finally frame your research question. In the next video, we'll be discussing how do you refine your topic and what further you need to make sure that your selected topic is right for you to conduct your analysis. So thank you.